Hi everyone, my name's Connor Howard. I'm part of the Radiotherapy and Oncology lecturing team, and you'll have quite a few lectures with me within your first year. So this is just a quick tour of our virtual reality software that we use throughout your 3 years on the course. Before we dive into it, at the time of recording, we are all working from home right now, so don't be alarmed if you hear a small child yelling. That's normal. Also, what I'm showing you here is our version of VERT, which we have on a laptop, which we can take to visits to the hospitals or open days. So at the university, we have a whole room dedicated to VERT, and this screen that you see here is actually projected onto an entire wall within that room, so it is very immersive. We also have all the hand pendants and controls that they use within the hospitals, so you can have a practice using them before you even go out onto your first placement. So here is our standard radiotherapy treatment room. So we'd be coming in through this door. Here is our lovely patient, and they climb on to this treatment bed, and then we can raise this up and down. And it does move that slowly in real life as well. So this bit here is our linear accelerator, often called LINAC. So this is what we're using to treat our patients with them highly ionizing X-rays. So our patient would be on the bed. We'd have to get them slightly undressed so we could see where it is that we're actually targeting the radiotherapy treatment. So again, we'd bring them right up, close to the machine. The beauty of using this VERT software first is that we can't actually harm the patient, so if we would go too high and crash them into the bed, into the machine, it's best to do it now. So what we can do with this software as well is we can add the beams on, so we can actually see where the radiation would be hitting. So again, when you're out on placement, you'd be setting up these patients into the right position. And then once you leave the room to start the treatment, the machine actually moves around and delivers the treatment from different angles. And does not move that fast. So to set up our patients, we turn our room lights off, we work in the dark, we place these lasers on within the room, and this is what allows us to line up our patients ready for treatment. Next thing that we can show you are these arms either side of the machine as well. So these actually take X-rays for us, similar to what the diagnostic radiographers do. And we use these X-rays to ensure that our patient is in the right position. So we take these outside the room as well, match it to what we have planned for our patient, make sure they're in the right position, and then that's when we start the treatment. Obviously throughout this, we're talking to our patients, we're trying to build a good rapport, good communication. Also with this software, what we can do that we don't actually have on the laptop version right now is that you can actually see into the patient, so you can see all the different organs that the treatment beam would be going through, because we need to make sure we're not over-treating any of the healthy tissue as well. Well, that's the end of our little tour. I hope you enjoyed it, and I hope to see many of you in September.